Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Tara Bevans, who is an addiction nurse with Baptist Health. Welcome.
Thank you for having me.
Now, before we get into the addiction part, Baptist has 100 years of caring, been in business a long time. They're having an event called Chalk the Walk. Tell us a little bit about that.
Correct. So, a few things are happening in the month of September. So, there is Suicide Prevention Week, and there's also Overdose Awareness Month. So, as part of the 100 years of caring, on September the 10th, from 10 to 3 at Baptist Lexington, we're going to have Chalk the Walk. So Chalk the Walk is an event where the employees will draw on the sidewalk in the community. We invite the community to come and draw on the sidewalk anything, just messages of hope, to hold space, to say you're not alone, and we're going to kind of incorporate at Lexington the addiction piece as well, since we do have an addiction team there. So we invite everyone to come out and just put great messages of...
And chalk the walk.
And chalk the walk, yeah.
Now, you mentioned Suicide Awareness Week, and there's a lot of crossover between addiction and mental health.
Correct, yes. About 40% of people that have substance use disorders also have a mental health disorder. So there is a lot of crossover in that. We call that a co-occurring disorder. So we work closely with, there is no psychiatric services at Baptist Lexington, but we do have them at Richmond and at Corbin in the Briscoe clinic. So I work very closely with them on the patients that do present that have the co-occurring disorder. We work closely to figure out, does the patient need more psychiatric care or does the patient need more addiction medicine?
Well, now, teens, I guess especially, but I guess anybody can end up being addicted or using a drug to treat anxiety, depression, or a mental health disorder.
Correct. We see a lot of underlying anxiety and depression. So I have that conversation with a lot of patients and ask, are you anxious normally? Do you have social anxiety? Do you feel depressed? And if they start saying, yes, I think so, or I felt like I've always been anxious my whole life, I say, well, have you ever been treated for that? And a lot of them say no. So that's when we really work together and say, well, maybe we should address the underlying psychiatric disorder or potential psychiatric disorder, and then that actually may help treat the addiction.
And when you say addiction, drugs, alcohol, I mean, it can be a multitude of
Oh,
things.
it's everything. We see a lot of alcohol use disorder, and alcohol use disorder is up to 50% genetic. So if a patient had two parents that were both had alcohol use disorder, it's highly likely that that patient is going to have alcohol use disorder or a substance use disorder. So alcohol is very genetic. Opioid use disorder and some of the other disorders are not so much genetic, but they are more pain, and it's not physical pain. It's a big history of trauma. So again, we're talking about that co-occurring psychiatric disorder and treating the person with kindness and compassion and finding out what is the underlying issue. Now, we do have patients that had chronic pain, and I see a lot of patients with chronic pain that ended up addicted to particularly opioids. So we deal with that patient population as well.
And it might be addiction to multiple things at one time.
Oh yes, absolutely. What's on the rise today is what we call speedballing. So we see a lot of fentanyl, and cocaine is on the rise. Cocaine is now in 70% of drug overdoses. So cocaine is definitely on the rise, and we see a lot of fentanyl and a lot of methamphetamine and a lot of catastrophic disease processes from methamphetamine, major strokes at very young ages, 30 and 40 years old.
You talk about fentanyl and opioids. Narcan is now available that can be used in an emergency situation.
Yes, and all of our patients that come in will get a Narcan kit, and then within the community there's many recovery centers where anyone can go get Narcan for free.
All right. Well, it is important to talk about, and if they need treatment, it's important to say, hey, I need some help.
Absolutely, and it is definitely one of the things we want to really impress upon people is asking for help is a sign of strength, not weakness. So.
Well, thanks for all you do. Thanks for coming in and talking to us.
Thank you. Appreciate it.
All right. We'll be right back.